First shots of a long battle, a 90-year-old pensioner from Enniskillen, first to get her COVID vaccine jab. We'll ask if it's truly the beginning of the end, how the rollout will proceed, not just in Brexit-bound Britain where it happened, but across Europe and the world. It's also a chance to measure the significance of the moment. The first ever inoculation against a coronavirus going to market in record time. Will the public be clamoring to be first in line, or will skeptics need a lot of convincing? Vaccine politics extends as well, by the way, to that public-private partnership that's made pharmaceutical giants and governments team up. With the Pfizer vaccine, it's U.S. Big Pharma, which is banding together with BioNTech. That's a German startup founded by Turkish immigrants. A tale of globalization that's worth noting in the face of a disease indifferent to territorial boundaries. Today in the France 24 debate, we're asking if these first COVID vaccines are indeed a turning point. Joining us from Lancaster, England, Dr. Mohamed Munir, virologist at Lancaster University. Welcome back to the show.
Thanks for having me.
Joining us from London is Matthew Oxenford. He is a lead UK and Brexit analyst at the Economist Intelligence Unit. Welcome to the show.
Hi, great to be here.
From Paris, Pauline Londex, co-founder of the Observatory on Drug Transparency Policy, aka OT Meds. Thanks for being with us.
Thank you. Good evening.
And from Nantes in Western France, Odile Duvaux, president of Xenothera, which works on COVID treatments. We're going to talk about that aspect of things in a little while. Thank you for joining us.
Hello, everybody. Nice to be here with you.
The France 24 debate, where you could join the conversation on Facebook and Twitter, hashtag F24debate. Yeah, shipped in from Belgium. It's at a hospital in Coventry that the first COVID shot was administered. Catherine Viette has more.
She may not look like it, but this woman is about to make history. This 90-year-old grandmother is the first person in the world to get the Pfizer-BioNTech COVID-19 vaccine outside of a clinical trial. Just a week before turning 91, and she's ready to celebrate. The vaccine is being rolled out across Britain on Tuesday, with the nation's most vulnerable given priority.
I'm keen to get it. Yeah, I'm in the extremely vulnerable category, so I hope that I get it as like part of the rollout at some point soon, and then just sort of go back to normal as much as possible.
Prime Minister Boris Johnson expressed cautious optimism while visiting a vaccination site on what's been dubbed V-Day.
We can't afford to relax now. And so my message would be, it's amazing to see the vaccine coming out. It's amazing to see this tremendous shot in the arm for the entire nation, but we can't afford to relax now.
Croydon University Hospital in South London is one of 50 clinical hubs set to administer the first doses, with a follow-up shot needed 21 days later to achieve immunity. It's been described as the biggest immunization program in history. Delivering the first 800,000 doses of the Pfizer-BioNTech vaccine is a logistical challenge, as it needs to be stored at around minus 70 degrees Celsius. In trials, the jab was shown to have around 95% efficacy. Governments and health agencies around the world will be watching the British vaccination program closely, taking note of its successes and failures as they hope to roll out similar programs in their own countries.
Dr. Mohamed Munir, again, it's been less than a year since we first talked about COVID on this show. It wasn't even called COVID at the time. How big a feat is it, the fact that those images of people getting vaccinated today?
I think this is incredible progress from concept to reality in 10 or 11 months. I think this is record-breaking. We never had a vaccine in this incredible time. And then basically the vaccine, the shortest time we have developed before was mumps took 4 years. And having a vaccine with 90 to 95% efficacy across different spectra of population, I think this is certainly a moment to celebrate.
Is it gone too fast? We heard the head of Pfizer today say no corners were cut. Nonetheless, your thoughts on it, the fact that you can get a vaccine to market this quick?
Yes, I think this is incredible news at one end. And the second aspect that I would like to highlight, as you alluded, is that certainly there is an element of hesitancy that probably any of the corner put this vaccine on a negative perspective. But that isn't really the case for.
I seem to have lost the connection slightly there with Lancaster. We'll try to reconnect. There's much ado about that first inoculation. And by the way, the second citizen vaccine, an 81-year-old from Warwickshire by the name of, can't make it up, William Shakespeare. And beyond the puns about taming of the flu and gentlemen of corona, it again highlights that the elderly are first served. And Matthew Oxenford, I've been reading that there's been a bit of hesitancy on the part of some because, well, the elderly have the greatest chance of dying anyway. So if what a public relations nightmare it would be if a lot of people get their jabs and die of something completely unrelated the following day, for instance.
I think if you look at who's most vulnerable and where this virus has been doing the most damage, the elderly are the most vulnerable, and it makes sense that they're going to be the ones that get the first vaccine. But the same reason that they're vulnerable to coronavirus makes them vulnerable to any number of other ailments. But this is the vaccine for a new disease, and it solves the problem that we've all been living with for this last year. If it can be brought out and limiting that mortality and morbidity that's been sort of the specter for all of us.
Is it gone too fast?
I mean, at this point, it's just started, and there's going to be several months before it actually gets to the point where we're going to see real sort of societal effects on it. So while there may be some sort of hesitancy, I think there are a lot more people who can't wait to get the vaccine fast enough.
All right, the UK Health Secretary defending the government's decision to roll out the vaccination campaign sooner rather than later. Let's listen to Matt Hancock.
We don't know yet how the vaccine impacts on whether you transmit the virus. We know that it makes you safe from the virus, and we've got to assess that, and we'll watch that very carefully as we roll out the vaccine. But of course, by protecting the most vulnerable, we'll be able to get on top of this virus once and for all.
So, putting l'index, you heard, yes, there are unknowns from the UK Health Secretary, but we're going full speed ahead. Do you agree with Matthew Oxenford that this is the way to go?
Well, I certainly agree that it's a great news that these candidate vaccines arrive to market now, because we certainly need these vaccines. I think there is one thing that we really need as well in order to make sure that people will want to be vaccinated, is to increase the transparency, including transparency around the protocols, around the different protocols of the vaccines that are being marketed, to know exactly what they are useful for. So whether if they reduce the transmission of the virus, or whether they reduce the severe forms of the disease, I think that's a very critical point for people who will want to get vaccinated, to know, to have these information very clearly. And I think governments have definitely an effort to make in order to build the adhesion, the willingness of people to population to get vaccinated.
Do you think that so far all parties are being transparent when it comes to rolling out the vaccine? We heard, for instance, this Tuesday that the one that's being jointly done by Oxford University and AstraZeneca, they might have to wait a little bit longer before they can get to market. Do you have confidence in the data?
Unfortunately, what we can criticize on the development of these vaccine candidates is that maybe there is some transparency now on the protocol. We see that Pfizer released its protocol today publicly. So there is some efforts that are being made, but as you can see, it's absolutely at the end of the process when the vaccine candidates are almost marketed in the UK. So what we would have needed is this to happen longer time. Think of Pfizer's first results announcement about 1 month ago or a little bit less. It was only the press release of the companies, and governments, based on these press releases, decided to purchase massive amounts of doses. So we can understand very clearly that we can't build governments can't build the strategy, the vaccination strategy of the population of the country with only the press release of the companies. So no, unfortunately, there has not been enough transparency so far, but we are definitely confident that right now the medicine agencies have all the data they need in their hands, and if they think that the vaccine candidate is safe to be marketed, then it will be marketed.
Odile Duvaux, of course, we're talking vaccines on the day the first vaccinations happen. That's normal. But you've been critical because not enough attention is being paid to other important matters, like, for instance, whether or not there are enough tests about. The head of Roche, the Swiss pharmaceutical lab, saying he's worried. And also treatments, which is your remit at your startup, Xenothera. You've been working on treatments since 2015. You're saying that governments are not paying enough attention to that aspect.
Yes, first I want to insist on the fact that really the vaccine is an amazing worldwide momentum, and it's very good to hear about that, and it's very great news. But my feeling is that when you are fighting a virus, you need first to think of people who are getting sick, and bringing a lot of energy and money, of course, on treatments has not been sufficiently, I would say, developed until now. So my concern is that people who are today sick, who are at the hospital, and also people who will get the virus before getting vaccinated, or even people who would be vaccinated and would not get enough defense against the virus, all these people are going to need treatments. I'm giving you two examples. You are all aware of tetanus. Tetanus is something against which we are mostly vaccinated. However, we still need treatments against tetanus. And for instance, antibodies against tetanus are today saving hundreds and thousands of lives worldwide every day. So it's very important to have in mind that even if you have a vaccine, we really need a treatment. And I'm really sorry to hear only about vaccines and not only about treatments. At Xenothera, we are in fact developing a new treatment against COVID-19, and it's getting to treat patients hopefully in the coming months. But I think it's too slow and under-communicated, that we say, to populations, because this is the first hope they need, is that when you get sick, you can be cured.
And do you feel as though your treatments that you're working on are being fast-tracked in the way that vaccines are?
No, really not. We're all aware of about this. As Pauline underlined, we know that vaccines there have been press release by big pharmas that they've been, I would say, incitating people and governments to market the vaccine very quickly and to test them on people, especially people with high risk. So this is okay, but treatments should also be fast-tracked, because many people have been dying from COVID-19 because there were no treatments available. And among these treatments, antibodies are really expected to be a real hope for patients. Monoclonals, obviously, but monoclonals are only interesting because they are fighting the virus with only one antibody, while polyclonals, like our treatments, are fighting the antibodies, attacking the virus with hundreds of antibodies. So they are expected to be much more powerful, and they are not enough fast-tracked, according to my opinion.
Matthew Oxenford, do you agree?
My view is that basically we're trying to get society back to something resembling normality. There's a significant amount of popular and public and governmental push for that. And a mass vaccination campaign seems to be sort of what's come available first. I don't think that means that research is going to stop. I don't think that that means that there isn't going to be further study. I mean, some of the basic research that formed the basis for the Oxford AstraZeneca vaccine that may be approved soon came from ongoing research into the SARS epidemic years after it was no longer a concern. So my view is that there will be continued scientific progress in this area. And also some of the technology that's been used to develop these vaccines shows a lot of promise in developing new medical treatments for new pandemics that may come in the future.
And at this point in time, Matthew, when you think about the optics of it all, and you have a bit of wariness over who stands to gain in all of this, your thoughts on that? We're in an age where everything's being questioned. Is first of all, the first question is it okay to question the science without being called an anti-vaxxer?
I think that obviously there are issues of transparency, and some of that comes from the unprecedented nature of the effort that's been put into this, and some of this is legitimate. But the Pfizer vaccine and some of the vaccines that are following will be subject to the same rigorous testing and peer review process that every vaccine and every medical treatment that is on the market today has gone through. And I think obviously there should be scrutiny, but it should be done in a controlled, standardized fashion so that those claims can be put to the test and found successful and safe, which is where we found ourselves.
When you had those three former U.S. presidents, Matthew, last week, who said they would take the vaccine in public, what was your reaction to that?
I think there is a lot of mistrust of public figures, of authority, of scientific endeavor, and I think trying to pursue some sort of campaign for that shows how that these vaccines are safe is going to be very beneficial and very necessary if this is going to be a successful public health campaign. And this is nothing new. There are pictures way back from the 1950s of Elvis Presley taking a polio vaccine. This is a very long-standing tradition of having people that are trustworthy, that are sort of well-known and well-respected and well-regarded by the public, step forward to try and sort of build some sort of public confidence in this.
Pauline Londex, you agree?
Well, I think as on the treatment versus the vaccine issue, I think I would like to highlight something. I think this is symptomatic of the lack of transparency around the public, around the decisions taken by the government. And it also shows clearly the lack of thinking of some governments on the priorities of research. For instance, as we have been denouncing it, the observatory, we think that for the vaccine race, we would have needed more cooperation between the developers, whereas we have seen a lot of competition and a lot of opacity. And we think that cooperation, collaboration could have helped to develop several vaccines that would have different uses and that could be used for different purposes. And I think this is the same for the treatment issue and the vaccine issue. The issue is that we have not seen at the governmental level or at the international level real discussions on what are the technologies to fight the COVID-19 virus that we would need to develop, including it could include, for instance, testing, different kind of tests, technologies that we will need to develop in order to fight, to give the better response.
Pauline, I want to follow up. I want to follow up on what you're saying, but we have to take a quick break. We'll be right back. Stay with us. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we're talking on the day of the first public rollout of vaccines against COVID. It's starting in the UK. It's due to come here to the continent in a few weeks' time, and the rest of the world, at various speeds. We're with Dr. Mohamed Munir, virologist at Lancaster University. Welcome back as well to Matthew Oxenford, who is with the Economist Intelligence Unit in London. Pauline Londex, co-founder of the Observatory on Drug Transparency Policy, OT Meds. And from Nantes in Western France, Odile Duvaux, president of the startup Xenothera, which works on coronavirus therapies. Just before the break, Pauline Londex, you said there was too much opacity when it comes to the process of rolling out these vaccines and deciding strategically what takes precedent. That opacity, is it from the governments? Who's it from? Explain.
So, for instance, we in France, we can see that there has been a total lack of transparency in the process of the development of vaccines, because we have to remember that since last March, gave a lot of public money in order for drug companies to develop these vaccines. And then from the very beginning, so from March, there's not been any clear communication from the governments to know what were exactly the different kind of candidates that were funded for this public money. And civil society or experts beyond some doctors and beyond industrials have never been consulted. So the government never consulted or included in the process civil society or other stakeholders.
Odile Duvaux, do you agree with that?
Yeah, I'm quite comfortable with what Pauline says. In fact, I think that our governments have been lacking transparency and also pedagogy. You know, it's clear to explain people that you need vaccines, but you also need treatments and tests, as Pauline says. It's clear for somebody who knows that he might be sick, that he needs to be curated, and it's also clear for somebody who might be sick that someday he could be also vaccinated in order to avoid to be sick. So I think people are not stupid, and they can understand that when you fight virus, you need several weapons. Vaccines are not the only weapon. Of course, they are a powerful weapon, but you need to treat people, you need to cure people, you need to avoid people from dying. And this is critical, and this has never been mentioned or very weakly mentioned by governments and politicians, probably just because they are missing a level of pedagogy towards populations. This is my conviction.
All right, the Skype gods are not with us today, so unfortunately, Dr. Mohamed Munir, we're speaking to you via telephone link now as well. Nonetheless, let me get your reaction to some of what's been said, and particularly whether or not governments are being clear enough in their messaging and in their decisions of how they roll out vaccines, and whether or not they put enough of a priority as well on treatment, on testing.
Oh, yes, absolutely. Well, thank you very much for having me back once again. I'm sorry for the issues with the internet here. So I am with Pauline and Dilo, who have been saying about the opacity and also the lack of clarity. Just to put into the perspective, I mean, if you recall the AstraZeneca trial, when they made the first press release, there was any clue that they had made a mistake in the dosing, and which was later revealed that through another press release. So now the data has become available today afternoon about the actual phase 3 trial that was now published in Lancet Journal. And the concept remained the same, that there was a mistake into the dosage. And I'm not concerned about having a mistake and then getting that mistake as the best shot. What I'm concerned is that why this information hasn't become very much public to the audience, who are actually really are the ultimate people who would contribute into the success of the vaccine. So certainly, not only just onto the AstraZeneca, but throughout, there have been concerns, and those not being revealed at the great level where it should have been. And these are critical steps, really, to gain public confidence into the vaccine coverage, because it's not just the vaccine, it's the vaccination that makes the difference. And we have to win the heart of the public to really reach to 75% of the coverage. And until we don't really reach to 75% of the coverage, we should not anticipate that the vaccine is going to bring a revolution into the ending this pandemic.
Yeah, getting it out to the public, 75% of the public, and you might even say 75% of the public worldwide. Pfizer's partner in the rolling out of the vaccine is BioNTech, by the way, one of whose founders is its CEO, Turkish-born German immunologist Ugur Sahin. His company insists that international cooperation is the only way to get enough people vaccinated with the promise of fairness in distribution.
Yes, absolutely. And this is critical when we talk about low and middle income countries, when we talk about minus 70 Celsius storage and the distribution. And we witness that in the low and middle income countries where the infrastructure in the hospital and healthcare setting is already frail, and they don't have an existing financial and infrastructural backing where they can store and distribute to the areas where it need to go. Just putting into the perspective, for example, when we talk about polio vaccine, that requires just an ice temperature. I mean, if you have ice in the cooler into the thermos, that is sufficient enough to take the polio vaccine. But it has been a logistic and really a big challenge to take into the tropical countries such as Nigeria and Pakistan, and that is the only reason that these two countries are still reporting polio virus. And talking about minus 70 is beyond imagination of a frail healthcare system.
Matthew Oxenford, in your reporting and analysis, do you get the sense that leaders around the globe really get it that to beat COVID-19, the whole planet has to get vaccinated, not just the happy few?
I think there are definitely groups working on this. There's the so-called COVAX program that's international sort of consortium that's specifically looking at how to get the vaccines as they're produced to lower income countries to ensure that the entire world is vaccinated. The success of the AstraZeneca trial may be instrumental in that because it has a lot fewer of the cold storage problems that the Pfizer vaccine currently has. But leaders in advanced economies in Europe and the United States, they're facing a very difficult choice politically in the sense that they got into office and they made promises to their own people to get vaccinations and to get life back to normal. And it's very hard to sort of turn around and give away to provide vaccines to the rest of the world, even though it is very clearly the right thing to do. And in the long term, it's something that must be done. It is a difficult political challenge that's going to prolong this pandemic worldwide, probably longer than it needs to be.
Matthew, you hit on an important point there. The Pfizer vaccine, it needs to be stored at very cold temperatures. I was reading reports today about companies that make freezers that can't keep up with demand. It seems like an impossible task rolling that out for the whole planet.
I mean, I think it's definitely going to take time, but I think the number of impossible tasks that we've seen in the last year is actually pretty staggering in and of itself, not least of which is the development of the vaccine. I think there's going to be a lot of money, a lot of investment, both public and private, in trying to solve these problems. And given the amount of disruption that this has caused the entire world, the sums that we've seen in developing solutions for this have also been unprecedented. And I think that there will be solutions, whether that's through other more effective treatments that don't need this sort of cold storage or some sort of innovation around how that can be moved. But it is going to take time, especially in countries where the -70 cold storage just isn't feasible at all in this current environment.
Your thoughts on the fact that Brexit-bound Britain gets the vaccine first, the Pfizer one?
It's just a reminder that the UK, despite all of its problems with Brexit and despite a lot of the economic travails that it's had in dealing with the lockdown, does have a very strong, innovative, high-tech pharmaceutical sector. It's no coincidence that before Brexit, the European Medicines Agency was headquartered in London. The pharmaceutical companies and the pharmaceutical regulators in the UK are very sophisticated, and it's not surprising, therefore, that that would be one of the first ones to roll out a vaccine. That being said, this is the difference in a matter of days, a matter of weeks at most. By the time the woman who got the first vaccine gets her second jab 3 weeks from now, most likely people in several countries will already have gotten their first. So it's a nice little thing for the UK to have in terms of self-pride, but in the end, I think most advanced economies will follow pretty quickly, assuming that the regulators are similarly positive.
Pauline Noldex, when you look at the big picture now and how you roll it out for the entire planet, your thoughts on the strategy that's being developed, particularly when it comes to the World Health Organization and international groups that deal with these big pharmaceutical companies and governments?
Well, to be honest, I am very worried with what's happening right now, because the previous speaker today just spoke about the availability in low and middle income countries. What we are seeing right now at the World Trade Organization is a proposal made by India and South Africa for all patents, all intellectual property rights to be waived on the Covid-19 technologies. And so this was brought it's a proposal by low and middle income countries, by some low and middle income countries. It will be discussed tomorrow. And what we have seen so far is that the European Union, including France, are against this proposal. So there is a big concern here that a major part of the world, a main part of the world, will once again be completely left behind the innovation. We know that already without, even if there was no intellectual property rights on these vaccines, we know that there is the production capacity issue anyway. So there will be a time for these countries to be able to be supplied or to produce anyway. But about to be rejected because of the opposition of the European Union and the United States. We fear that the innovation will really reach at the last moment, the low and middle income countries.
Mohammed Munir, do you agree?
Oh, yes, I do absolutely agree. And I just want to add point to Matthew's COVAX facility. Certainly, there is a concern by the WHO that the developing countries might not get to the point where they have equitable access to the vaccine. Therefore, they set up a COVAX facility. But the problem is that it has its own limitation. The COVAX at the moment has only offered 3% of the low and middle income countries' population. And that 3% isn't sufficient enough even to vaccinate the frontline health worker, not talking about the vulnerable communities, which are really very high over there. So therefore, I don't really see it's going to make a big impact in the near term. However, there must be a great level of financial contribution and logistic contributions toward making sure that the vaccine, not just only the availability, but really incentives to get it vaccinated. Because I myself am from Pakistan, and I can fully understand the ground realities. And so far, the equitable distribution of the vaccine is not trained by the local realities.
Local realities, yeah, it's going to be difficult getting it around the planet. There's an important issue that I need to go around the table about, and that is, morale, because we're facing this unprecedented pandemic. We're coming up to what's here in the Northern Hemisphere, the winter holiday season. And we're seeing, for instance, here in France, that we just had our second lockdown. It started well enough, as you can see on this chart. Intensive care units no longer overloaded. But the diminishing rate of infection seems to now be sort of stalling here, particularly since shops started to reopen. And the government warns it may delay a further loosening of lockdown.
After a sharp drop, the decrease in the number of positive cases has been stalling for a week now. Every day, more than 10,000 people test positive, compared to 5,000 per week in the summer. We must be vigilant over this recent development, but we're far from our goal, which is to drop below 5,000 cases per day.
Sous la barre des 5 000 cas par jour.
Odile Duvaux, are events unfolding the way you expected?
Well, I would be glad that the number of cases are getting slow down. Obviously, it's good news. I want to come back on what has been mentioned by Pauline about worldwide cooperation and also competition. I am completely convinced that the competition is going to be established for procurement and supply. And this is another reason why to consider also treatments as a good weapon, because you don't need so many treatments as you need many vaccines. We all know that the incidence of bad cases in this COVID-19 is very low, and many people are just going to have asymptomatic disease. So instead of beyond vaccinating the whole population, you can, I would say, more easily reach all sick people, because it doesn't mean so many doses of treatment. So this is another important thing. Obviously, even if the number of cases are getting low, you'll still have people needing to be curated. Even if the populations are widely vaccinated, our calculation is that, for instance, in France here, the need is going to be between 100,000 and 200,000 per year, even if 80% of the population is vaccinated and protected. So this means that it's still a huge need and this is only France. Obviously, if you look at Europe and the whole world, it's going to be very important. I also agree on the fact that we also need to consider the level of price that's going to be necessary to produce all these innovative technologies. And in this has to be a criterion to decide what type of innovation should be promoted, because we really need to be concerned about the access for low-income countries to these innovative products.
Matthew Oxenford, are you confident that world leaders will put a lid on price?
I think that it's something that has been discussed. I think right now it's not as much of a priority as it probably should be. I think at a certain point it will become more of a vaccine. This will be sort of treated more as one of the many diseases that unfortunately is limited to poorer countries, and sort of put into that bucket, and probably more out of sight, out of mind for world leaders once their own populations are addressed, which in some ways is unfortunate given the degree of suffering that's probably going to go on in the meantime. But I think that still every day, every month, every year, there is going to be further progress on developing new therapeutics and vaccines.
And how's your morale? Because you have on the one hand, again, this momentous record rollout of the first vaccines that go to market this Tuesday. On the other hand, the news from the United States, where we're seeing the record number of COVID cases, and it seems to be out of control. How does the winter look where you're sitting in London?
I think if we look at what the vaccine actually means, it means that this isn't necessarily going to go on forever. I know as late as October, there were people saying this is just something we're going to have to learn to live with. This is something that is going to take years to get back to normal. And the vaccine does provide the boost that quite possibly, if we get through this winter, come spring, there'll be warmer weather, it'll be easier to socialize and meet friends and do things outside. And by the time we get back to the fall again in September next year, by then, at least in advanced economies, there will be substantial vaccines and hopefully herd immunity, at which point we can really say we've gotten back to normal within a relatively close run period of time. But that does nothing for what's going to happen in the next 3 months, in the rest of December, January, February. And it's going to be a difficult couple months, just because there are going to have to be continued restrictions. There are going to have to be continued business closures. There are going to be people who still get quite sick and die. And there are going to be hospitals that are going to be working at full or even over full capacity. And that's just, it's two very difficult emotions to square, the sort of optimism in the medium to long term and the grim reality of the next few months in Europe as well as in the United States.
Pauline Londex, is that your frame of mind as well?
Yes, absolutely. I think we have to balance also what we think about the situation, because we don't know yet how long the immunization with the vaccines will last for. So there are many things we don't know, and people will have to learn. We will all have to learn to live with this virus until we get effective vaccines in plural, different tools, treatments, as it was mentioned. All the tools that we need to really end this pandemic.
Mohamed Munir, when you look now at what we've learned the past year, and you look ahead, what do you think is the best way to get through the winter, if you will?
Yes, absolutely. I agree with the points of Matthew and Pauline onto what we are going to foresee in the winter. But I just would like to add in there that probably this winter would be different than in any winter we have seen. First, because we will have a winter pressure of the respiratory problems. We know January, February will be the time when the number of cases, particularly in the UK, would be significantly higher. And there is a possibility that we will have a third lockdown in January, February because of the mixing of the people during Christmas time and the festive season. So that means that we will have a norovirus infection that is really peak during January, February time. Influenza would be coming in, although we've been trying to have vaccination coverage for the flu jab enough, yet there would be possibility that the number of cases would go significantly high. But one thing I would like to emphasize is that 2021 will certainly be different than 2020, and that difference would be definitely because of the vaccine.
All right.
A level where it has to be before we see the benefit.
All right, so be braced for a third lockdown, but there is light at the end of the tunnel. Dr. Mohamed Munir, I want to thank you for joining us from Lancaster University. I want to thank Matthew Oxenford in London, Pauline Londex in Paris, Odile Duvaux in Nantes. We want to thank you for joining us here in the France 24 debate.